Welcome, everybody. Welcome to episode number 2 of Inspire Innovate. We've got a great group of healthcare providers, payers, individuals from the research side, individuals from the investment and the business side. We're going to have a really good program for you guys, for anybody looking to get into healthcare, anybody looking to do a career switch within healthcare. I think we've got a solid group of people that can answer any of the questions that you have. The format of today will be, hour and a half of discussion. We've selected a few questions from the audience that we thought were pretty good to have that discussion points. And, I'll look to ask some of the panelists that we have. Just for administrative, next seminar is going to be on the oil and gas segment. And so we'll be forecasting that and the date and time, and we'll be announcing that soon. That should be a really good one as well. Unfortunately, Uzair, who is normally the moderator, is not able to make it. I don't look as good as Uzair, but I'll look to fill in his shoes, and we'll look to have a really good program. He's always in a blazer. I refuse to be in a tie or a blazer. And so, sorry, I can't look as good as him or speak as good as him, but I'll try my best. We've got a solid group of panelists. I'll ask for introduction from everybody. If you could structure your introduction so that you can inspire everybody and let everybody know what you've done. You guys, each one of you are rock stars, inspirational. I'm taking notes as you guys are talking, and these are tidbits and advice from me. And just so you know, the profile that we have, we've got frontline, docs that are dealing with COVID. We've got dentists. We've got senior executives from the payers and provider side, and we've got individuals dealing with regulatory on the healthcare. So if we want to just start from the top left and go across with introductions, we can get started.
So I guess go first.
Go for it.
Assalamu alaikum. My name is Maz. I'm currently formerly a researcher at Harvard Medical School, Mass General Hospital. I've recently switched over to consulting. Prior to that, I've worked in the oil and gas sector, if you will. A lot of my research translated directly to that, and then I switched over to more biotech, healthcare research. And I'm happy to answer questions about that switch, either from oil to healthcare and healthcare to consulting.
Excellent. Mundassir?
Hi, assalamu alaikum everyone. Mudassir Zahir. Look, my background is Silicon Valley Bay Area startup technology. I've worked with multiple startups, both as a founder or as an advisor. I'm currently working with one large startup called Lubic. I joined McKesson about 6 months ago as a corporate VP responsible for technology, operations, and delivery for our oncology and infusion businesses. And the reason, I joined McKesson was because I have personally been impacted by cancer in my family. So I wanted to make a difference in that field. And that's why I made the switch. In case you guys don't know who McKesson is, McKesson's a 187-year-old company. It's the 7th largest corporation in North America. And we focus on distributing pharmaceuticals, including the COVID vaccine, providing health information technology solutions, medical supplies, and care management tools. Thank you.
Excellent. Thank you. Imad?
Hey, assalamu alaikum everybody. Imad Ahmad, based out of Minneapolis, Minnesota. I'm a healthcare executive with United Health Group, the largest health payer in the US, roughly about 325,000 employees across the globe in roughly 2,000 locations in 17 countries, and really with one mission to help serve the individual consumers that we serve. I've had the unique privilege in my career of leading not only from the payer side, but also from the consumer, the provider side. I've also had the opportunity to lead teams around our business, specifically in Latin America, as well as in Europe. And in my current role, I currently lead our strategy for Rally. And Rally's mission is really to improve the health and outcome of consumers, really working around personalizing the data-driven care information and recommendations that consumers need in today's healthcare ecosystem. And I'm excited to share some of those experiences and background with the rest of the panel, as we have a good panel that can continue to answer questions that you have in the industry. So looking forward to it.
Excellent. Zahab?
All right, assalamu alaikum. My name is Zahab Ehsan. I'm a fellowship trained orthopedic surgeon with my focus in sports medicine. I completed my residency training at the University of Washington in Seattle, and then did fellowship focusing more in sports medicine at the Hospital for Special Surgery in New York City, which is the top renowned orthopedic hospital in the United States. Over there, I had the opportunity to work closely with the New York Knicks, where I was a assistant team physician with the NBA, and then also closely with a lot of the other professional athletes in New York City, namely Giants, Mets, and Rangers. I've started practice in the Chicagoland area, again, taking care of high-level athletes as well as athletes of all levels, again, beginning at the high school level up into the weekend warrior, those of us that are still continuing to pursue those pursuits. So I'm happy to discuss my career trajectory and for those that are pursuing such.
Nice. So free tickets from the Knicks. Who else did you say? Go ahead, Khalil.
Yeah, Assalamu alaikum, everyone. My name is Khalil. I'm a assistant professor of bioengineering at New York University, as well as NYU in Abu Dhabi, where I'm currently calling in from. Prior to this, I finished my PhD in the HST program, basically biomedical engineering program at Harvard and MIT. Most of my research has focused on translational medicine with a specific focus on neuroengineering and basically thinking about how we can use different engineering toolkits to better deliver therapy for a variety of different disorders. The other hat I wear outside of the research arena is that of being involved with the healthcare entrepreneurship and innovation scene. As Vikar knows, I was one of the previous directors for a group called MIT Hacking Medicine, which focuses on sort of early stage healthcare innovation really across different sectors. And yes, I think overall happy to talk about and answer questions for anyone who's interested in research or the academic track, as well as anyone sort of interested in getting into entrepreneurship or innovation.
And I want to say most people are able to say that they did this badass program at Harvard or they did this amazing program at MIT. Khalil does both. Go ahead, Yasmin.
Hi, salam everyone. My name is Yasmin Shabi. I am a general dentist. I trained at Harvard School of Dental Medicine. I am currently owner and founder of a dental office in Boston area, which focuses on prevention and the mouth-body connection. I'm also an author, and I wrote a book on that topic during COVID. I currently split my time between Boston and Abu Dhabi. And in Abu Dhabi, I practice dentistry with a focus on treating sleep apnea through dentistry.
Excellent. Nice. Asra?
Okay, assalamu alaikum. My name is Azra Belleen, and I am a Chicago native, but relocated into Dallas. I am a pharmacist by training and began my career in the traditional pharmacy track before moving up to the corporate office for Walgreens. Then for there, I spent many years working in the corporate environment. Later on, then transitioning actually as a healthcare strategy consultant for a global firm in New York. I currently work for a company known as Vizient, which is the country's largest GPO, running three main areas within their drug division. That's responsible for branded pharmaceuticals, vaccines, technology, as well as all of the marketing programs for the manufacturers. For those of you who don't know what Vizient is, outside of it being a group purchasing organization, it's a healthcare and performance improvement company. And so we support 60% of all of the hospitals in the country and 95% of all of the academic medical centers. So we perform all of those back-ended functions and support and ideas and innovation for a lot of the healthcare systems in the United States. In addition to my role within Vizient, I also serve on the board of directors for the Greater Elgin Family Healthcare Center, which is located in Chicago. It's one of the country's top FQHCs, so federally qualified healthcare centers, which is focused on providing primary care, obstetrics, and dental healthcare to the underserved populations. So I'm happy to share any of my experiences with anyone. My career trajectory was not exactly what I had expected. So happy to share with anyone if they're looking to take new turns in their career.
Excellent. And I think that's a perfect segue with COVID. There's a lot of individuals displaced, a lot of individuals, especially in the Houston area, in the oil and gas side, And we're looking at healthcare as one of the growing industries. Maybe I can maybe we can start with this one question. What do you, and we'll go around for everybody. I think you all have a different trend. So what do you see as future trends within your field? And is there something that you think healthcare is doing that people should capitalize on? If you're looking at future outlook, where is healthcare going, and what do you see that trend is headed for healthcare?
Sure.
Go for it. I think you're muted, Maz.
I can start if you want me to.
Yes, please.
Sorry, thank you for that. So honestly, it doesn't really matter whether you're in the biological space or the chemical space. I think digitalization and the understanding of how to use computers to do machine learning, that is going to be a critical skill set. I mean, I know that I have my brother-in-law, he's in graduate school right now, and so he's doing chemistry, and they're required now to learn how to do machine learning or something as a skill set that they're going to be able to implement beyond just the basic science that we all are doing. Khalil can probably talk more about this and how digitalization and computer learning and that aspect of science is becoming a more and more forefront of everyone's mind.
Yeah, no, happy to chip in. I think, healthcare as an industry the short answer is it's not going anywhere. And I think if anything, what the last 6 months have shown us is that it is sort of critically important and relevant to everyone, no matter how healthy and young you are. I also think that it's a sort of industry that in many ways has checks and balances that I think are good, that have led to it sort of not incorporating as cutting edge technology as other industries have. And sort of as a result for that, there really is a lot of space for sort of innovating or doing things a different way. And I will say to most people, even those who are from outside the healthcare sector, that I think there is a lot that sort of you can contribute. I mean, it's not always easy to find the avenues to sort of get involved, but I think people would be surprised how many things in healthcare are done empirically just because that's the way it's been done for many, many years without many people thinking about it. So I think, I would definitely encourage people, no matter what the background is, if they are interested in the space, to try to get involved through sort of different initiatives. And I think above all, just sort of think critically about how we can improve certain things, because chances are everyone has an idea they could use.
Yeah. Imad, it sounded like you wanted to add something.
Yeah, this is Imad. I'll just add to the great comments that Maz and Khalil made. I think as we think about what does the next kind of healthcare system look like as we go through the evolution, to me, they're kind of like 5 key principles that at least I think resonate where the market is. One is, I think the healthcare system is going to continue to need to build and shape a health workforce by advancing diversity and inclusion in the workforce, investing in healthcare data. So if there's folks that are interested in analytics, improving kind of the existing workflow capacity between what we're seeing between primary care physicians and the payers, where the payers are starting to narrow their networks to get more volume to the primary care providers. There's going to be a need for data and analytics. The other piece I would say is there's this huge focus currently in the market around reducing the cost of care by strengthening consumer engagement. So if there's folks in the audience that are interested around human-centered design, thinking about consumer journey maps, really kind of thinking about how do we become more transparent in the healthcare system around incentives, around optimizing sites of care. There's a need for marketing folks, design folks, and I would say human-centered design individuals as we look at the healthcare ecosystem. The other I would just say that probably resonates is really the strengthening of patient-physician relationships and how to help navigate that. So when we think about the ability to connect and think about the white space in the ecosystem today in healthcare, I think that's another big one. And then I'll finally just say that there's a need, at least on the payer side, as we work with the providers, is how do we better deliver on outcomes? And I think there's a huge need also to think about how healthcare can be delivered in the home with health literacy and helping manage chronic condition management.
Yeah, that's a really good list. Anybody else that want to add to that?
Yeah, just quickly. So I want to echo what Imad said, but speaking to anybody on the call who's in the technology domain, the healthcare industry is going to go through a number of, our Y2K type moments, primarily through regulations and federal regulations and laws that are slated to go live here shortly. And these laws are in two spaces, right? One in pay for performance. So you're seeing, even on the radiation oncology side, for example, you're seeing an alternative payment model now, right? And those require huge, massive systems to all course changes to core systems. And the second is regulation in the space of physician burnout, right? There's a huge issue in North America around physician burnout. We are burning out our doctors, and these people are leaving the industry, going away when they're in their 50s. There's just too much for them to do, and there are regulations in the work that are going to help that. And again, those would translate into new technology solutions that impact really every core aspect of a practice. So, if you're interested in the healthcare space and you're a technology, there's lots of room here. In addition to what Imad and Maaz said, and around AI, machine learning, those are having a huge impact, right? So, in our business, for example, we have hundreds of scribes, people who sit with doctors and take notes, right? And now we're digitizing all of that. We're moving towards AI with solutions like DeepScribe, which are enabling us scribes to do more. And for every scribe, 15% efficiency translates into hundreds of thousands of dollars of revenue for the practices to reinvest back into their patients.
Yeah. Maybe I can hear from the provider. So, well, let me back up a second. One of the things that came in as a question was, what is a payer and what is a provider? Just for admin, payers are individuals who are actually paying for that service. So health insurance companies, Rally Health, and anybody else who's looking to pay for that service. Provider is someone who's providing that healthcare service. So your dentists, pharmacists, and your MDs of the world that are actually able to touch that patient, nursing, and all that is included within that. So maybe I can hear a question or that answer of where you see the future trend from the providers that we've got dental, pharmacy, and MD. It's impressive that we have all three. It's great.
So what I would say is, from where I sit, obviously my position's unique because I get to see what all the trends are in a large portion of the hospitals. And so one of the things that I'll say is, what Maaz and Mudassir and Imad and Halil have said, in terms of technology is actually quite true. But what's the even more immediate need, like right now, like tomorrow, like next week, is actually on the operations management and process improvement side. I can't tell you how many C-suite executives from various hospitals that I've spoken to who have shared with me their experiences from what's going on now with the COVID-19. And we talk about how the healthcare system has been broken. And for many of them, we've had this conversation where I said, if you had a small fracture before, you're starting to see full-on breaks in your foundation, in your concrete. Small infractions about how one department in a hospital communicates with another are now coming to light in a very big way because it's causing very major problems in how they run their day-to-day operations. And so one of the trends that I'm seeing is, and their direct feedback, one of the CEOs had said to me, whatever plans we had for our healthcare system for the next 5 years have been like accelerated down to 9 months. Like they actually said things that we thought we could never accomplish because of potential resistance and politics within their own healthcare system have just been greatly accelerated because the need was so much there. It was so prevalent that, now people had to stop thinking about how much it cost or if somebody doesn't like it or if it's going to take somebody a really long time to learn it. They just had to do it, right? Because you've got patients in front of you who really needed it. And so I say that for those people who are in healthcare, as well as those who are considering a career in healthcare, that this is one of the most immediate trends, that if you have a diverse or broader skill set in terms of just thinking logically and in operations management and in process improvement, those are the areas where hospitals right now are hiring, like right now, because they have such an immediate need. And unfortunately, the people who've been working for them, they're still ingrained in doing things the only way that they know how. And this is a great opportunity for people who are not in healthcare, because there are certain concepts and operations models that we take for granted in other industries, whether you're from banking or manufacturing. For us, it might be very simple if you come from one of those backgrounds. When you come into healthcare and you're like, oh my God, you haven't thought of that. And so that injection of what to us might seem common ideas are actually new ideas in healthcare could really move the needle forward in terms of fixing potentially some of those fractures that the healthcare system is experiencing, particularly in hospitals.
Yeah, spot on. Yasmin or Zahab?
Sure, I'll take the cue of fixing fractures and talk a little bit about orthopedics and how I kind of envision that kind of on a day-to-day level and going forward. I think Mudassar made a huge comment about how we may spend a lot of time doing paperwork, and actually in January we're supposed to be trialing this eScribe kind of artificial intelligence system where it's going to start out by having this recording going on in the patient room while we're there, have a computer output, and then have somebody review it and then kind of go forward from that. But the vision is that ultimately artificial intelligence is going to help document for us. And that could, again, as he mentioned, could totally change the game with regards to efficiency with number of people that we can see at a certain time, how much output we have from a patient care standpoint. But then otherwise, I think technology as a whole, and I think we've talked very specifically about different elements there, has such a role, I think, within healthcare that can really revolutionize the field. I think there's a lot of paradigms that have been in place that can be challenged, particularly from a systems and efficiency standpoint that Azra mentioned, that can really change the way you provide care. I think, historically, we really relied on the face-to-face interaction with the patient, and I think that's great for establishing rapport. But I think going forward, there's a lot of things where you don't have to see your doctor in person to accomplish the goal, and it's actually wasting time, perhaps for you and for the doctor, to go through that process of you have to travel there, you have to park, you have to wait, etc. And so I think obviously the virtual space has been huge for us, especially in these last 6 months. And I think as those technologies improve, I think Zoom and this type of virtual communication is great, but I think on the horizon, and one of my surgical mentors was telling me, is that he's been talking with the company that's going to have the ability to virtually take him to an operating room somewhere else in the country so that he can coach or teach somebody or kind of walk somebody through a certain procedure. And I really think that is something in the future that potentially could be very valuable. So those are some insights that I see, but I think as a whole, I think there's a huge role for technology within healthcare, and it's all about efficiency.
Yeah. So I'll add to that. I agree with what everyone has said in terms of systems perspective on healthcare trends, and even also in terms of technology. At least dentistry is coming up with some really great technologies to make treatments a lot more minimally invasive with much faster healing time and fewer complications. I think from a patient standpoint, at least in oral health, we are also trending towards more prevention-based techniques. So reducing how many times a patient has to come into the office, especially now with COVID. People don't want to go out, to a healthcare facility unless they really have to. So focusing on prevention to avoid complications, lengthy treatments, costly treatments. I also see oral healthcare trending to a more whole body approach, trying to integrate more beyond being just tooth mechanics, and working with physicians on total oral body
excellent.
health connections.
And just to tease apart some of the golden nuggets that y'all gave, it looks like we all know that the healthcare industry and the healthcare system as a whole has got a lot of fractures, broken in a lot of places, and looking to solve problems in a creative way seems to be the answer. And getting individuals from different industry and collecting that data, concentrating on that data, the design side, identifying cost, identifying the financial structure and how we get reimbursed or how the payers are paying versus how the cost is being associated from the provider side, patient physician contact, and making sure that those adherence questions and those patient contacts are being addressed. And then on the regulatory side, we've got a whole lot of AI tech that's coming in, and a whole lot of regulations. And as you know, or maybe you don't know, that healthcare is the most regulated industry that exists. And of course, there's innovation that's necessary on the innovation side. From that list, for all the audience that exists, whether you're on the financial side of the equation, or you're on the tech side of the equation, or you're on the administrative side of the equation, or you're on the provider side of the equation, you can see how you can make an impact within the healthcare system, and all of it needs some sort of improvement. Maybe I can, tease apart the two topics. Why don't we go a little bit into the, administrative and the value-based care that you mentioned, and if we can take a little deeper dive of what that actually means, how someone can make an impact, or where that industry is going, and how someone can actually get into that, or if they can get some background on it, that would be great. And Imad, I had this question out for you if you want to get started.
Yeah, absolutely. So I appreciate the question. Really, where I see the market going, right, is we need to shift from fee for service to more of a value-based ecosystem, meaning how do we start to just not treat, but how do we add the value of that care to those treatments? And where I think, Rally Health and United and the payers are going is really kind of three concentric circles go through my mind. One is, how do we create the future of the digital clinic, right? So the notion there is, as Azhar and Zahab and others were mentioning, we need to start to create like a digital centers of excellence where you can access a provider 24/7, 365 in any portion of the country. No different than if you were to go to Baylor Medical Center to have your procedure done. There is a need today in a value-based care contract to have that interoperability across state lines to be able to see your provider, and then that provider to get based on a value-based contract. So that's kind of the digital clinic concept. Then I think there's this whole notion starting to move towards what I call digital therapeutics, which I know Yasmin, Khalil, and Zahab were talking about, where we're going to have to start to build in partnership with providers around a value-based care software solutions that really deliver real-time evidence-based therapeutics and interventions. I see a time when your physician is actually going to prescribe you a digital therapeutic. That's not too far away from where I see value-based care going. And then the final piece I would say is COVID has really driven the notion that care needs to now be delivered in the home, through the virtual visit, through patient remote monitoring for a diabetic, for a heart failure consumer, where how does your body speak when you're not in front of your caregiver or provider is where I see all of this kind of tying together. So in summary, you're kind of increasing patient engagement, you're ensuring the interoperability between the EMR platforms for that data, and then you're really delivering on a continuity of care with a whole person approach.
Mm-hmm.
Yeah, just to echo what Imad said, from a value-based care perspective, right? So we are making huge investments in precision medicine. So instead of carpet bombing a disease, we want to offer treatments that are targeted, designed for individual based on the variability in their genes, environment, and lifestyles, right? And that requires huge amounts of data and analytics. And tons of opportunities gained for data scientists. There are tons of data scientists in the energy space, right? We would love to have them on our side.
Yeah, and I wanna stress on the transferability of skills, and Yasmin and Khalil know this through Hacking Medicine is, maybe you can speak a little bit about that and how different individuals from different industry have an impact. Or at least from what you guys are seeing, and talk about how you can translate that and how you see if you're hiring somebody, or if you see somebody out at a social setting, how do you see someone that's at a completely different industry looking to get involved in healthcare? And if you're in the hiring committee, how do you see that person's resume, and what would you recommend? How does that look?
I can start. So I don't know. I mean, I think to me, the most important, first of all, the short answer is it stands out a lot. I think, a fresh perspective is extremely valued in a field like healthcare, where sort of people who've sort of have been in it for a long time sometimes struggle to sort of question why a certain thing is a specific way and why it can't be different. I think my biggest advice to sort of people wanting to get in and sort of like applying to fields that they are not experts in is basically to just be honest and straightforward about what exactly has driven you to it. And I think there are I can't think of a single field where I think your background might not be relevant in a field like healthcare, because you can come at it from the sort of more clinical patient care side. You can come at it from the sort of pure IT computer science of like, how do you actually deliver, or to Azra's point, how do you coordinate things on the back end in terms of operations management? If sort of you come from sort of more of a research setting, you can come at it from how do you develop new tools and technologies and new therapies. You can come at it from a chemistry setting. So there really is, I don't think there's a single field that is completely, you cannot make the claim is relevant to healthcare.
Yeah, spot on. I agree. Anybody else want to add to that?
Yeah, but from a slightly different perspective. So just like, well, I guess the example I give you is one of my best performing employees in technology used to be a dosimetrist. He used to measure doses for radiation treatments. And he knew the domain. He knew what the patients want. He knew what the providers want, right? And he brought that skill through technology. So having domain knowledge or learning the domain, right, is more important than knowing technology, for example. That you can, we can train you on that.
Mm-hmm, mm-hmm.
Yeah, I would just add. I would just add, when you think about the intersect between healthcare and the financial services industry. So we're starting to see legislation around price transparency, for example, right? The Trump administration just published the requirements for hospitals, for providers to publish, for payers to publish. So if there's somebody, what I look for also is someone who has transferable skills from the financial services industry, because there's a lot of overlap. When you start to think about value-based care, how are you going to show the price transparency? How are you going to tie those to the provider contracts to be able to show and display that from a portal perspective? So, really the competency to me is around, do you have the skill? Are you confident in that skill? And then can you effectively communicate in terms of both written and verbal? And what's your true north compass that you're going to bring from an integrity perspective? As long as you're bringing those core, I'll call it leadership skills, I think, from my humble opinion, those skills can be transferred between industries.
I would agree with that. Yeah. I mean, I absolutely. When we're looking at different candidates for jobs, we're not really zoning in as much on your technical skills, like, oh, so you've done this before, and so here's what it is. But we're really more focused on whether or not you come to the job or can come to the job with a broad base of skills. That, because having a broader base of skills but doing them well will allow us to work with you, and you over time also develop a certain amount of flexibility and resiliency. One of the things that everyone here has commented on the different segments is this is going to be changing, and it's going to be changing rather quickly. And so we're much less focused in on the technical skills as much as people want to think that it's technical skills. We're far more interested in your ability to build cross-functional relationships, in your ability to articulate yourself in a manner that is succinct and gets your point across. And also whether it's in the verbal format, or in presentations or in a written format, because surprisingly, even as we're moving more into the digital age, particularly we see it in our younger applicants for jobs, they actually have a much lower level skill set when it comes to communications. And we're finding this actually, this is actually one of the top 3 problems that most executives in organizations are complaining about. Even in hospitals, they're talking about their residents, their pharmacy residents, their medical residents, and they're actually finding that they lack a lot more of the critical thinking skills, and that they actually lack a lot of their presentation skills. And so it's actually surprising, because we've made so many advancements in technology. But I think what it's done is it's caused people to over-rely in certain areas of technology and forget that when they're looking at positions, that's really what people are looking for today. They can get a computer to do a lot of things for them, but being able to present and speak well and articulate that message to multiple stakeholders in different ways is a skill set that is valued in any industry.
I saw a lot of nodding heads. Anybody want to expand on that?
Yeah, that's interesting, because so one of the first trainings I have all employees take is the 7 C's of communications, because Azra spot on. Communication is a huge issue, especially nowadays with new college hires.
I I think it's interesting because Azra, you also went from a pharmacy background to a consulting background. And so, I mean, I'm also coming from a technical side, right? Like a PhD in chemistry and going into consulting. And so for us, the actual business stuff, we can learn rather much on the fly. It's how do you communicate that? How do you take what you know technically and how do you communicate that to others and convince others in a meaningful, articulate manner, I think is much more effective and much more important nowadays.
And touching back when we talked about the intersection for, Imad talked about the intersection of healthcare and finance and how we're going to need that. One of the other things that I did want to bring up was also, and this goes back to the communication skills, is actually the intersection of healthcare and regulatory. For those of you who may have a legal background, a lawyer background, paralegal, maybe you've worked in policy or public health policy, or maybe you've done a lot of volunteer work for nonprofit organizations. What we're finding is that even when technology does advance, a lot of the rules, policies, laws in your local jurisdiction or state or at the federal level may have taken a lot of time to catch up. And so there is that disconnect as well. And so that's also another opportunity that I did want to highlight, that if you're coming from other industries and you're looking at where the healthcare is going, as we are evolving rather quickly, we need the regulatory landscape to also catch up in order to make that effective. I mean, we talk about maybe some of the earlier discussion about the provider visits, right, and being virtual. The truth of the matter is we've had this technology around for quite a bit of time, and it really wasn't leveraged until it absolutely needed to, with the COVID-19. But I mean, I think it's pretty sad that 3 years ago, many of the healthcare insurance companies didn't cover virtual visits, even though we had the technology to do so. And they could have, but they didn't. So that's kind of the example of how sometimes we have great innovation and ideas that are taking place at the grassroots level. But in order to actually make it effective, we would need people to kind of work more on that policy and regulatory side.
Yeah, and go ahead.
No, Azra, I appreciate the comment a lot. As a recovering lawyer on the phone, I can attest to the fact that, 15 years ago, I made that switch from, I didn't want to be a litigator. I wanted to use the skills that I had as a lawyer and bring it into the healthcare ecosystem, and it's treated me well. To your point, their skills are very transferable and they're needed, to your point. So I really appreciate that call out.
Yeah, and maybe I can ask, one question that came in from last name Khalil, not Khalil. There seems to be big cracks within the delivery. Is that related to cost, or is that making profit? Where exactly are these cracks coming from? When are these cracks big enough for someone on the outside to create a plan to innovate within that space? Do you see that at all? And where do you see those cracks? Somebody want to take that question on?
So look, most of the innovation in our space is not driven by cost reduction. That's not the goal. The goal is almost always better patient care or improving physician burnout. Those are the two primary drivers for us. We never really focus on cost. I can look. I'm thinking about the top 10 initiatives that we have going on, and none of them are based on cost. They're all about patient care or physician burnout.
Yeah, and maybe I can ask Zehab and Yasmin, because I know you two have been working on the innovation side and you're on the provider side. What do you see as the reason why you got involved, or at least on the intersection between healthcare and innovation? Both of you are muted, by the way.
Yeah, sure.
Sure.
I can speak to it from an oral healthcare perspective. Into incorporating technology for us is something we do to decrease patient inconvenience, so reduce appointment time, increase healing. So if it's minimally invasive, they have less discomfort afterwards, and by making it faster and more efficient, it helps the patient, but also the flow of our practice.
Great. Yeah, I think that's an excellent question. I think from a cost standpoint, initially innovation is often more of a cost, but I think with the future kind of long-term goal in mind is to be perhaps for making a profit. But I think absolutely, as Yasmin commented, that a lot of the innovations, for example, in sports medicine are about getting people back on the court or the field quicker. And how can we do that? And a lot of those, I'm sure Imad comes across things like platelet-rich plasma injections, which are not currently covered by insurance, but there's more and more research. And so at this point, cost is definitely an issue, but there are certain issues and technologies that we feel are a benefit and have longer-reaching consequences. So, things that we're trying to innovate definitely can be very expensive up front.
I think a lot of how we're going to solve the gaps in the healthcare ecosystem, like I think about if I were to book a flight, for example, on Delta and fly, if I don't know the cost and I don't understand what that cost is, because the onus is now more on the consumer than more before, right? You've got your own HRA, you got your own HSA, but how can you go shop for those services? And there's a big need in the ecosystem to be able to display that so that a consumer and a patient can make the right choice and then get connected with the right physician for the quality care. So I see, to me, one of the big pieces we're going to have to continue to evolve, and to the question about the gaps, is how do you start to display price transparency on services in the healthcare ecosystem? If I looked in Minneapolis, for example, if I go in the northern part of the city, a colonoscopy could be roughly about $5,000. If I go to the southern part of the town, it could be $3,000, right? So why is there that cost variation? And we need to bring that transparency of cost to the consumer, because ultimately that's who we're serving.
Yeah, that's spot on. Maybe I can shift a little bit to the younger audience that may be watching. What advice would you have? I've heard a little bit of soft skills, developing your communication skills and making sure that you're enthusiastic and passionate about what you're chasing. What skills and what advice would you have for the younger audience who's transitioning from high school and thinking about, subjects to study, or in college, maybe they're in engineering or they're in healthcare? What advice would you have for them as they, start their career?
So I'll start on that one. I'll say that I work with a lot of students in general who are trying to make that transition either to high school or college, or actually college to graduate school. And the things that I'll say right off the bat is, and because this is not common in younger people, but the ones who master the skill at this age are the ones who tend to be incredibly successful. And that is get organized. A lot of folks, when you're in high school and college, you're used to actually having a lot of free time. You're used to taking 6 hours to write your resume or to do these other things. And the truth of the matter is that when you're actually out there in the workforce, or when you're actually out there trying to get one of these, jobs that you really want, you won't have all of that extra time. And so a lot of younger people actually stumble when they first get out into the workforce, one, because of those lack of skills, but most importantly, they actually don't know how to manage all of those things at once. They really don't. They don't know how to manage doing their laundry, visiting their parents, getting their own healthcare, going to work, and learning a new skill. And so my advice to people at this age is, get organized. Actually put yourself on a schedule. Even if you have the extra free time, put yourself on a schedule and follow it, even trying to do it for 2 weeks and see how you perform on that. And I would be remiss if I didn't say this, to the folks who are younger. I get asked this question all the time when people look at my career path and they say, well, how can I be successful? And my number one answer to them is make sure you're praying 5 times a day. And that's the truth in a variety of reasons. Number one, it enhances your grounding, your mind and spiritual connection. If you're not already grounded yourself, you're going to find yourself spinning out of control when difficult situations arise, or when you're trying to make those transitions. And number two, though, it puts you on the schedule. There's a certain amount of discipline that comes with that. And when you become more disciplined, any transition that you try to make in college or in high school or in graduate school becomes much easier because you've trained yourself in that level of discipline. So those are the top 2 things that I always advise students of that age.
I mean, so going off what Azra said, I think one of my favorite football players was a gentleman by the name of Inky Johnson. Inky Johnson, for those of you who don't know, was a rising star. He ended up getting severely injured and paralyzed in his right arm, not able to make it to the NFL. But he had a really important process that he said, love the process and the results will come. So don't think of the process as, you're just like grinding away. The process is refining you and helping you build, as I was saying, like the skill sets that you need to succeed once you get to the destination you're trying to get to. And then once you get to that destination, you always have to be thinking about, like, how can I improve? How can I, you don't get complacent once you achieve that first goal you want. It's always about being ready to, like, all right, now goal 1 is done. What's goal 2, and what do I need to get there?
Mm-hmm.
So the one advice I would have, especially for the millennials and the Gen Ys on the call here, is that just keep in mind that the person who's interviewing you is most probably not a millennial or a Gen Y, and what's normal for you is very unusual for them. So and I'll give you a couple of examples. I'm on the talent acquisition committee at McKesson, and we were doing some college interviews for interns. And I had someone who took the interview, it was a video interview from the car. Now, he may have had a perfectly valid reason for that, but I don't know what that is. And it might be acceptable for a Gen Z to talk, interview each other from the car, but it's not for me, right? I don't expect that. Or I had another one who took an interview and there was laundry hanging behind them. So just keep in mind that know the person who's interviewing. You're fine.
Just check
keep in mind that the person you're interviewing with, research them, know who they are, and try to understand who they are. Look at it from their mindset. What's normal to you may not be normal to them.
The piece I would add is even at this stage in my career, I use an outside mentor, right? Who's your champion? When you get more and more into your career, starting and then as you progress, you got to constantly ask yourself, who's your mentor? Who's going to champion for you? And who's going to be that advocate? And then that requires, in my humble opinion, starting like identifying who are those mentors early in your career, because you're going to have a lot of different things thrown at you in different ways. And even at this stage in my career, I still use an outside mentor to help me as I think through kind of the business, the challenges, and how to lead teams in a complex environment. So I would just encourage you to identify that mentor, determine if you're in a company, who's that mentor and champion within the company as well to help you.
Just to add, I guess, as the academic on the call, I'll tell a couple of the standard academic things. But building off what Imad said, I will say identify a mentor and don't be shy to talk to your mentor. I mean, if someone is agreeing to mentor you, I think the idea is that you should be able to reach out to them and don't be, people are busy, but they'll answer when they get a chance, and they will answer if they want to help. And that's kind of, then if they don't want to answer, then they're probably not a good mentor. So it kind of like self-selects. But I mean, if we're talking more sort of for people transitioning to college or transitioning to potentially graduate school, I think it's, don't follow a specific trajectory just because sort of that is the natural trajectory that people in your field follow. And I think everyone on this call, has very impressive sort of trajectories that some are more linear than others. And I don't think there's really a right or wrong answer. I think it's okay to sort of shift. It's okay. My major is this. Why would I go do this sort of research? And that's perfectly fine. As long as it's interesting to you, or, if you have like an itch that you sort of need to scratch to get it out of your system, it's fine. Even if you don't like it 2 months in, just go experience it yourself, and then you'll be able to at least say whether or not you like it. From the graduate school side, I think the advice is a little bit different, just in the perspective of try to identify what you would like to get out of it or why you are choosing to pursue it. Because I think a lot of people go to graduate school because they're just, because they don't know what they want to do. And I think that's okay. But make sure that you have some understanding about like why that specific program will help you identify what you want to do. Not just because I need, doors to open or sort of just to enlighten myself. I think there's other ways to do it that don't necessarily overqualify you in case you don't like that field anymore.
To echo what Khalid said, my advice, it's also, I can't take credit for it. My mom told me this when I was transitioning from high school to college, is in the beginning, say yes to many things. Even if things seem a little bit not exactly on your path, just have an open mind and say yes to different experiences. And being a student is a very special time in your life, and also in the academic setting. Older people or mentors are very kind towards students, right? So don't be afraid to email somebody to ask them to shadow or to ask for certain experiences, because as a student, that can open a lot of doors to try things out.
if I can, just kind of jumping on what Khalil just brought up. He brought up a really interesting point about graduate school. And I think that there's an opportunity to get like a free master's, if you will, for a lot of people out there who don't really utilize it. So Khalil and I both have PhDs, but in order to get our PhD, we had to get a master's degree in walking, if you will. And so for a lot of people, they decide that they want to go to, let's say, go to MIT, go to Columbia, get a master's degree, and they pay $60, $70, $80, $90,000 for it. If you apply for the PhD program, in essence, you get that master's in free. So 2-3 years in, or a year or two in, you can say, you know what, this PhD isn't for me, and you get a master's degree for free with research credit, with connections made, and then you can use that connection to network. And so, kind of going back, I see that people are asking about like networking. Use your primary network, which is people you know on LinkedIn, and then your secondary network, the people that your people know, and your tertiary network, and kind of grind at that, and make sure that you are kind of constantly being the person, like, never take an off day. Kobe Bryant never really took an off day, right? Like even when he was relaxing, he was still thinking about like, how can I get better at my game? And so when you're networking, you always want to be thinking about, like, who are the people that I admire the most that have the jobs that I want, and see, who are their mentors, and who, like, try to get them to mentor you, would be advice that I have.
And just adding a couple of things to, I think, what Maz was saying. One, if you decide to do the master to PhD thing, don't link it back to Maserati. If you want to purely say you're doing a PhD to back out into yours, just don't.
Yeah.
If you have a genuine, even 1% interest in the PhD, then that's all good. Then you can totally do that.
Yes. Sorry. Thank you for putting me legally out.
The other thing I want you to say about networking, just because it's something that I feel like a lot of people say, and it's not always easy. It's sometimes exhausting. I will say one of the sort of little nuggets that I really enjoyed learning is whenever you go to sort of any event when COVID passes again, and you can actually interact with people, don't think about every interaction purely initially from the sort of networking perspective. Just try to like hang out with people, talk with them, make a friend. Like they don't have to be close friends, but I think that networks work better when they are somewhat organic and not so clearly a quid pro quo of what can you provide to me and what can I give you.
You know what, and to echo what Khalil said, absolutely. I mean, some of my most, I guess you'd say, rewarding networking relationships were never networking relationships. It was you go to a fundraiser event and you're sitting next to somebody, and the next thing you're just striking up a conversation, or you're out with some friends and their older brother or sister comes home, or cousin or uncle or auntie are there, and you just sit around and you have a cup of chai with them, and you end up learning a lot more about something that honestly you didn't even know you were looking for to begin with. And they tend to be much more meaningful, and you get a lot more out of it. The other thing I did want to say, because we were talking about, I guess, academia and going for the PhD, is some of the folks that I have mentored were people who had done a master's or a PhD and then came out and then said, however many years later, maybe right away or maybe some years in the future, and said, the job market isn't there for me, or my interest or passion isn't there, or this isn't what I thought it was going to be like when I was done. Right. And that happens to everybody, quite honestly, in a lot of different fields. And so the one thing that I will say is for people, especially for people who are in high school and college, is this is the best time in the world to try and shadow someone. I mean, and learn a little bit more about what are the things that you truly enjoy, right? Like maybe you like talking to people, and maybe you're also just as equally comfortable, working in a more introverted fashion. But when you're actually in a job and you're doing it 40, 50, 60 hours a week, you might find that you're getting fatigued interacting with people. And I've known people like that. They're on their second, third, or fourth job, and they're like, you know what, I can't deal with people anymore. And they're wanting something that's different, and vice versa. They can't stand the quiet environment that they've chosen. And so for those students who are going from college to graduate school or high school into college, you're at this point where you can go ahead, and the best thing I would say is if you can ever shadow someone, do it. Right. I mean, if you can actually go to work with them, if you can actually sit in on a few things, if you're thinking about going the provider route, ask somebody, hey, can I come in and volunteer at your office? Or, just because you need to know what your day-to-day life is going to look at. Because when I talk to folks who are looking to make a transition who are unhappy with their, current environment, it's usually because they can no longer work in the day-to-day. It's not that they lost the passion for that particular subject matter. Chances are they probably still love that subject matter. They probably still love technology or chemistry or anything else, but it's the day-to-day of what their job looks like is what's really causing them to want to make a transition.
And that you're spot on. And Zahab, maybe I can ask you a pointed question. I've got a lot of aunties and uncles asking me about med school and how do they get their kids in there. And I've got a lot of kids that are asking about med school. Maybe we can start with number one, how has COVID, changed your environment? You're a COVID doctor. How has that changed? And then maybe you can also back into what does that student or that parent needs to do to, get into the physician side of the world?
Yes, that's a loaded question to say the least. A lot to cover, I guess, and I'll try to be as succinct as possible. I think the realm of COVID is quite unique. How it's impacting healthcare, especially from a training standpoint or medical student standpoint, I think I've witnessed that firsthand as my wife is a medical student, and she's been very limited in her clinical interactions because a lot of medical students have not been allowed to enter the clinics, or they're trying to minimize, the number of people that are involved in healthcare as there's a need for. So I think there's been some more virtual components to medical school, and that may persist as long as perhaps the risk of COVID remains real. But I think more from a global, for those who are applying or planning to pursue a career in medicine, I think, as in any of our careers, it starts with scholastic excellence. So really kind of putting forth your best effort and pursuing, excellent grades and standardized test scores. But I think what really has, at least in the last 5 years that I've perceived sitting on some of these admissions committees, has been people want you to have a real life experience that kind of defines you beyond the academic pursuit. So whether that would be, I think, within the healthcare field, and I think technology is also opening some of those doors, but I'll give you my perspective. I actually did an undergraduate in biomedical engineering and very closely wanted to mirror what maybe Maz or Khalil have pursued in their careers and thought about it long and hard and actually did an internship that kind of showed me that maybe that wasn't where I wanted to be, that I really did want to be in the clinics as opposed to in the laboratory setting. And I think that's very valuable. But going forward, a lot of people have sometimes had a separate career, or they have some sort of experience that's given them maturity outside of the classroom. And a lot of medical schools really, really like that. And so I think having a story, having an explanation for why you want to pursue a career in medicine, but also having some sort of real life experience that supplements that, I think is very valuable. And those real life experiences, I think, given the world that we're living in, are changing. And so there's all kinds of different avenues, and I think different people on this panel can probably complement that with suggestions on how to pursue that. Going back to COVID, I actually had a unique insight this past year when I was in New York City. We pursued March. At the start of March, we had a full kind of surgical schedule, full clinical schedule, and March 12th, pretty much we shut everything down. And from that point onwards, every week, every day was kind of like a new kind of news coming forward. And so what that transitioned to is by April, instead of being an orthopedic surgeon, I was providing COVID care to inpatients in our orthopedic hospital because that was where the need was. So our outpatient surgery center had been transformed into an intensive care unit. Wow. And it was very unique. For me, it was regressing to a lot of skills that I had learned in medical school and had to pull out, some textbooks and review things that I hadn't thought about for a long period of time. And a lot of people around me did the same, and we kind of came together to do that. So for the month of April and a little bit of May, we were working about 3 or 4 12-hour shifts a week, providing COVID care. And so that gradually improved, and we kind of went back towards orthopedics. But the insight there showed me that, God forbid, inshallah, that this doesn't happen again. And two, that we can move beyond this. I think a vaccine will be very, very helpful. But I think a lot of, from a standardized standpoint and from a technological standpoint, as Azra had mentioned, there's been a huge impetus to push healthcare in a different direction after COVID has started. And so I think, that kind of segues back into this industry of how we can technologically improve what we're doing. So I hope that helps kind of give a little bit of insight.
It does. And, going back to the original question, we were asking, what advice do you have to the individuals, youngins that are starting their career? And what I thought was really interesting is not a single one of you mentioned study this subject, and everybody was going after, being ready to pivot, getting organized, praying on time, the process of change, understanding how you take into that process of change. Mentorship, finding that champion. Linear careers aren't really the best careers, or they are the best careers. It doesn't really matter. You can change your careers in the middle. Networking, figuring out a way to network, shadowing, and seizing the opportunity, essentially. And I think I would really want to point that one item out, is that these aren't subjective or objective subjects that you can chase. No matter what you're studying, you can apply these skills and you can apply these to anything that you're doing. And I think that's the critical piece, that is the piece of advice that you want to take away. And I want to add one more item. Because of COVID and all the change that you're seeing, there are a lot of people that thought of negativity comes in and that creeps in. And I want to make sure you stay positive in the change that's coming in, whether you've lost your job, you're losing loved ones, or you're seeing your loved ones being sick. Keep that positivity up and trust in Allah, right? Like, He's the one that's planning. No matter how many plans that you have, He's the one that's the ultimate planner, and He's going to plan what's best for you, not necessarily what you think is best for you, but what actually is best for you. So if you're staying true to what it is that's happening, make sure you're following the basics of praying, and I think that trust factor goes in a lot more than you'd think. That can I pivot into one of the topics that you guys had brought in? With COVID and the transition, it looks like a lot of the items are going online. So what, for those individuals that have been on the IT or MIS, it seems like an easy transition, but that's even hard. So what advice would you have, or how do you transition from, this world of engineering and being hands-on to now this data analytics, AI, and the online informatics world? How does one, start that research or even begin to think about transferability of skills within healthcare, from the provider side, from the payer side, and from the research side? What would you guys give as an advice? Everybody but Mudassir is muted. So let me go at Mudassir. What do you think?
Look, I think, first of all, data science, right? It all comes down to data science. And I guess the easiest answer would be there are some predefined design patterns, right, that you can learn. So it doesn't matter that you're in oil and gas right now, but if you have some basic backgrounds in data science, then as part of that background, you have learned some design patterns, and those design patterns are just as equally applicable in the healthcare space. Mm-hmm. That's the most scientific answer I can give you. Just understand and just bring your core skills with you, right? And you learn the space. I mean, when I did, as part of my master's at Harvard, I took a number of classes on data analytics, right? And all of our case studies were in insurance. And one of them was about OkCupid, which is a dating app for all things, right? Or banking. None of them were about healthcare. Yet I'm here running, a technology organization focused on data science in healthcare.
Yeah, it's funny you mentioned that. The first 3 days of my job starting, one of my senior VPs came in and was like, "How much do you know about pivot tables?" And I was like, "I know Excel and I know how to put in sum equals or equal sum and average, but pivot tables?" And so I had to pick it up, and I couldn't say no because it's a senior VP coming in to ask. So I was up all night learning pivot tables. So you're spot on. Anybody else that want to address data online AI equation that's happening in healthcare?
I think the other. Go ahead, Azra. Go ahead.
Yeah, no, I was going to say from a more basic level, just even getting entry into data and analytics and informatics in the healthcare sector. So at Vizient, we have a PGY2 residency program that's dedicated entirely to informatics. And I'm one of the preceptors for it. And what I'll tell you is that for folks who were first getting into it, even just having some of the most basic skills, like if you understand SQL, if you know how to do those dreaded pivot tables, if you can call yourself advanced in Microsoft Excel, I'll tell you right now, there is definitely something within healthcare on the data and informatics side that you can make a contribution to. I think some people are somewhat intimidated sometimes when they're trying to make that transition, that they need to have some very large technical skills in order to make that jump. But in actuality, there are some really simple and basic things that if you can know how to do them from just an informatics and data perspective, and you have some of those logical, critical thinking skills, you could really help to solve some of the more what are considered to be very simple questions that really just need people who know how to put some of that data and analytics together. So that was kind of what I wanted to cover outside of the big fish of things like AI.
Yeah, I'll just add to Azra's comments as well. I think from at least a Rally Health and a payer side, we are focusing very much on social determinants of health. So if there are folks within the audience that have social health background, I think payers are really making a concerted effort to try to help that vulnerable population as we think about digital and bringing care in home. I know, for example, Humana has launched kind of its value-based care around social determinants of health, and payers are starting to invest in communities to build homes, to build transportation, et cetera. So if there's folks that come with that logistics background, and I'll call it social health aspect of it, I think there's tremendous opportunity for you to pivot in your career to help support some of the things that are happening in healthcare.
Anyone else?
So, I mean, I know that this is Houston, right? So oil, gas, probably huge, large number of people probably like we're talking to probably have some background in oil and gas. I work with Dow. I mean, I know what chemical engineers do. I've done that before. If you can understand, like, build a mass reactor, like all of that complicated kinetics and all of that stuff, a lot of the data analytics are just derivations of that. So it's taking the skill sets that you've already applied and just tweaking them and relearning some of the more nuanced aspects, but you have the fundamentals down.
Yeah, no, that's spot on. And maybe I can ask on the other tidbit that came in was mentorship and finding that champion. Whether you're employed or unemployed, what are your advice? If you're chasing the medical school route, what are your advice on how to find the proper mentor? The professor that's going to write you a recommendation letter, or is it the student, or how do you do that? And then on the other side, if you're chasing a career in research or on the corporate side, how do you find that mentor?
Yeah, on the corporate side, I would just say be tenacious. To Khalil's point, if somebody's not responding, that may be not worth your time, but as long as you're tenacious and pursue it for the right reasons as part of what's your compass, where are you planning to go, and finding that mentor within the healthcare space. If you continue to pursue it, you'll find it and learn from that individual as they kind of have obviously gone through their course of their professional endeavors within the company.
I guess I would say is don't be shy. So I get maybe 100 requests to connect on LinkedIn every week, and I ignore most of them because they are just mechanical. Somebody says connect, and then it sends out a sort of a default template saying I would like to connect with you, and I know what those are, and I ignore them. I answer the ones where somebody takes the time, makes the effort to say, hey, I really want to connect with you. I want to learn from you, or I want to interact with you for some reason. So, that takes initiative. If you take initiative, I will respond to you.
I would suggest that when people are even considering getting a mentor, I think someone said it here earlier on the call, making sure that you're selecting someone that, is doing what you want to do, right? Is in a field, or he or she is already in something that, you're like, man, that's my dream job. That's really where I want to be. And there's two real aspects of mentorship that, and most people focus on the first one and not as much on the second one. The first one being, looking at somebody who has the job that you want, or has the technical skills that you're looking for, or, can advise you on what I would say the more technical aspect of career management. But the other part of the mentorship is what I would call that soft side. And by that, I mean, if you are a diverse candidate, if you're a female, if you're somebody who wears hijab, if you're somebody who has a beard, there are other little nuances that go into being successful that, having a mentor, it's sometimes, as you're navigating through those additional challenges there, it's really important that you're talking to somebody who can not, I don't want to say help with it, but who at the very least understands it. Doesn't mean that you wouldn't necessarily get a good mentorship relationship out of, let's say, the typical white guy, right? I mean, you probably could, but as you're getting a little bit further along, it's helpful to have those relationships and mentor relationships when you're selecting someone who can kind of talk to some of those other points. If you are somebody who is practicing, there are little underpinnings of when you're in your career, how to navigate social events. If you're somebody who doesn't drink, how do you navigate, certain other, instances in your career? Because we talked earlier about how soft skills are important, but you're also being rated upon your social skills. And for many individuals who are not used to being in that environment, particularly in the corporate environment, they kind of freeze. I've known people who were technically really sound, really great people, had, lots of really nice friends, but they kind of froze. They didn't know how to engage in some of these social environments, and how to do it in an authentic way that was true to their Islamic values. And so when you're looking for a mentor, obviously exactly what everyone else has said, don't be shy, but also make sure that you're not also just picking just anyone.
Mm-hmm.
Just one thing to add there, building on that. I mean, if you really don't know, have no idea where to start, just reach out to someone who has followed a trajectory that you would like to follow at that specific point in time. I mean, I think that's the really easy way to pinpoint it. Bonus if you can find any point of connection with them, because it makes them more likely to answer. But honestly, like, I've had people reach out to me and others that, it's kind of flattering for someone to reach out to you and be like, yo, what you have done is really amazing, and I want to be just like you. Like, how can you not respond to an email like that, right? So I think that's like, if you really have nowhere to start, I think that's sort of a good place to start.
I agree with that 100%. The only other thing I'd add is you can have mentors at very different levels. You can have a mentor who's just a year or two ahead of you, and some of those can be very, very helpful because they know exactly what is going on currently, whereas you can have a mentor that's 5 or 10 years ahead of you that things might have changed a little bit, but they still have valuable insights. So I think you taking that into account, it's important to have mentors at each stage and to seek each of them out.
And while you're unmuted, maybe I can ask you guys a pointed question. How do you see, while you're sitting on the hot seat on the medical side, how do you see COVID changing what you are doing with the patient and your interaction? And do you see a systematic change happening, or is it very slow, or what's your perspective on that?
So some of the direct changes we've seen, we're no longer shaking hands with our patients. The connection there, I mean, it's a cultural shift. I anticipate that it'll come back, but it may not completely come back in the future. So I think that could be a permanent change. And then I think more from a system-based standpoint, patients oftentimes are not allowed to come to the doctor's office with a family friend or accompanying person, because that lowers the number of touches, so to speak. So I think that for a lot of people, if you have the comfort of having your spouse or your parent or somebody come along with you to a doctor's visit, now you have to go alone, that can change that experience for you. I think those are some of the more direct things that I've observed.
Yeah. And for Yasmin, similar question. I know dentistry had a pretty hard hit, especially with the aerosol procedures. How did that impact, and what did you do to pivot? And is that why you found time to write a book?
Yes, that is exactly why I found time to write a book.
Nice.
We were closed and I was at home for 3 months. But we pivot, and I'll say, dental offices are cleaner than ever. We're so clean now, and maybe that's something that we should have done from the beginning. So sometimes these things are not terrible. Hopefully, once even COVID is over, these are things that we continue to implement in healthcare. So yeah, I mean, in terms of that, we've obviously implemented a lot more technology, a lot fewer. Now we're paperless instead of, fully electronic. Instead of having people use paper, we're doing electronic scans instead of using, impression material and things like that. We use extraoral vacuums to reduce aerosols. So we pivoted, but, I think it's a good thing. And I think people are starting to feel safe in coming back and getting things done.
Yeah, and I think one of the things that, when you're looking at that practice pivot and the linear trajectory of careers and how you're pivoting from one subject to another, I keep looking at Maz and how you're going from research into consulting, or Azra, how you're doing that. So maybe you can, for those who have pivoted and don't have that linear career, how did you, decide to change that career? What data were you looking at? Whose advice were you taking, or what mentors did you have? What played into your, career change, and how did you go about doing that?
I'll let Azra go first because I'm just making that change now. I'm in the process of making that change, so I'll let her answer first.
So I will say I have made a total of 4 pivots already in my life. The first one was a frontline healthcare worker. I graduated and I was a frontline pharmacist in hospitals and in retail settings, seeing patients and doing prescriptions and counseling, etc. And but I already knew. I knew when I was in pharmacy school that I liked the corporate world. And this is actually why I tell students all the time, pay attention to that little voice. Now, voice was not loud enough to say that I was ever going to do that with my life. But I remember even when I was transitioning from high school to college in my first year, I would take the train downtown to Chicago to University of Illinois. And one of the sections I always used to read in the newspaper was always the business section. It was always the funnies and the business section. I don't know any other 17-year-olds who gravitate towards the business section of the newspaper every morning, but I just found it interesting. I had no idea that I was ever going to pursue a path in my career, anything close to it. So I transitioned from being that regular pharmacist, frontline healthcare worker into the corporate environment because I just had this instinct that I was like, I might like it. Now, just because I might like it doesn't actually mean that I'm going to get a job in it or that they want me, right? And so going back to some of the points that some of the other speakers had made in terms of being tenacious and then the point that I made earlier and some of the other folks did as well is that, whatever Allah has planned for you is going to be planned for you, right? And there was a certain amount of confidence that I had in that. Like knowing that did not make me afraid then to try, right? Because I'm like, yeah, whatever Allah wants is going to happen. If this is meant to be, cool. If not, then that's not what he wanted. And so I pivoted into the corporate environment. And from there is actually where I got all of my corporate training, my actual business training and learning all of those things. And that's the other point is don't be afraid to say yes, right? I said yes to a job, not actually even knowing what the job was. But I had full confidence that if I got the job, I would study night and day to get myself up to speed technically on whatever it was that I needed to be successful in that position. After working in that corporate environment and being successful at it for a number of years, when I left, I transitioned into the healthcare strategy area, actually predominantly advising private equity and institutional investment firms. So that was another big pivot because I wasn't just working now in a corporate environment. I'm actually working now with more investment and finance. And that was a huge pivot. I was totally scared and freaked out about it. And how I landed into it was really actually from other people coming up to me and saying, you'd be good at this. And I'm like, nah, I know what you're talking about, right? I mean, I was not somebody who had a finance degree. I did not have an MBA at that time. And I'm sitting here thinking, really? And that's why I focused back in on shadowing. Actually, when you go and you see what somebody else is doing in that job, you're like, oh, yeah, well, I could do that. I might actually enjoy it. And so I pivoted into that really because of unsolicited advice I had from people who were already in that industry. And so once I started doing that, it was great. Now in my current role, honestly speaking, it's surprisingly a mesh of all of those previous experiences. So now I'm in a corporate environment doing business and finance and procurement and supply chain, as well as actually impacting programs that are direct patient care. And and that's, as somebody else said it earlier, Allah's the best of planners. And it really is true. I don't think you expect later in life that all of these things are actually going to combine in some, beautiful puzzle. And it really did. And so I will say for those folks who are listening, regardless of where you are in your career journey, when you're thinking about making those transitions, think about the things you like, take unsolicited advice from people, believe in yourself, and believe that Allah's going to work things out for you,
Azra, it's actually really funny you said you accepted a job without knowing exactly what it was.
Didn't know what it was.
I literally did the exact same thing. I got an offer, like it was an offer that was too good to refuse, and I was like, sure.
Yeah.
So very similar to Azra, like I think it's really important to figure out what drives you, like do you want to be in patient care? Do you want to help, advance society? And I think that's kind of what drives a lot of us in this space. And for me, it kind of came down to the question of when I was looking at, where do I go from here? I had an offer to go to a pharmaceutical company, an offer to go to consulting. And when I was weighing out those two, I realized I could spend my entire career working on the bench to maybe getting something that might get into humans, but would never really help anybody. And when I looked over to consulting, it was something I never thought about, never even prepared for, spent 10, 12 years of my life preparing to go one way. But the opportunity to go and really help patients, kind of get the care that they need and the drugs and pharmaceuticals that they need, trying to push that into the market and push that directly into patients was something that just was too appealing for me to turn away from. I mean, I think that there's for every disease, there is a cure. I think that's a guiding principle that drives a lot of us in this space. And it's one that if you're not in this, if you don't buy into that fully, I don't know if you really can succeed in this space in a way.
Mm-hmm. Mm-hmm. And I know, Imad, you had a similar non-traditional route as a recovering attorney. What advice would you have for anybody looking to pivot?
Yeah, I always like to say that it's your mental model. Where is it? But then also your career is iterative. I think a lot of folks on the phone have kind of explained that, Azra and Maz, it's all iterative. You're going to continue to go through that, explore. Allah opens up risk opportunities for you from areas you would not even believe as you go through that journey. It's that faith and belief that Allah is watching out for us, and explore. For the young folks that are on there, explore and take that opportunity because things will open up.
Mm-hmm. Absolutely. And maybe I can ask a slightly different way of the same question. If someone is in your shoes relating to what you're doing, whether they're academics or they're chasing dentistry or they're chasing medical school, what is the tangible advice or tangible career advice that you would give them coming out of whichever phase they are in?
So I would tell them, don't be afraid to step out of your comfort zone. It's really, really important. Just because you go to school for one thing doesn't mean you'll find a job for that one thing. The US economy is very dynamic, mm-hmm. and there are mm-hmm. several factors that are driving change, digital transformation being one of them, right? Significant disruption. Imagine if you were in the transportation space and how Uber has transformed that space, or if you were in the delivery space, or you were in the hospitality space, how Airbnb has transformed it. So don't be afraid to step out of your comfort zone, because if you don't become a disruptor, you will be disrupted yourself.
Oh, so good one-liner there.
I do want to add one thing that I think we sort of haven't touched on with too much detail, which is sort of this, the opportunity to get involved in healthcare sort of through, I would say, entrepreneurship in general. We've talked about research, medicine, sort of provider, more traditional professions, the corporate environment as well. But this is sort of definitely a growing field, and I understand that it sort of requires a certain appetite for risk to get into it. But I think there are increasingly more and more programs that allow people to sort of try to meet people with like-minded interests in terms of healthcare, in terms of incorporating new approaches to healthcare. and in doing it almost on a part-time basis while you still have sort of your main gig. I think depending on where you're located around the country, if there are sort of similar events, incubators, hackathons, just anything to kind of get you involved, I would just say if you're sort of thinking about the area, it's a good way to do it without necessarily dropping everything that you have set up and going somewhere else.
That's a really good point. Anybody want to expand on the entrepreneurship side? Because I think that's a really big point that you're making. Number one, a few of you may not be having your regular jobs that you're there. You've got time. You're trying to figure out what it is that you need to do, how to pivot your resume. How do you fill that gap? Maybe the answer is identifying a critical need that you're seeing out in the community within the healthcare space. And whether you're good on the finance side, or you're good on the analytics side, or you're good on the computer science side, or good on the engineering side, you could build something or you could code something to solve that problem. And that sort of, fills that gap on the resume, gives you a talking point so that you have a fresh perspective. I think that's a really good point on the entrepreneurship side of the equation. Do you, I guess, coming back to Imad, Mudassir, Azra, do you see, when individuals are looking at resume, and when you're looking at the resume, how do you see those gaps, whether they're gaps for maternity or they're gaps for unemployment? How do you see those gaps? What advice would you have for individuals that have those gaps and are trying to get into the workforce?
So look, at least at McKesson, and I think most large corporations now, HR, talent management, and people in recruitment have been trained to ignore those gaps, because people realize that there's a life outside of work. People have to take maternity leave. People have to go on I had an employee who used to take 6 months off because he used to go hike. He was going to conquer every single peak in the world. And it's understandable, right? What we're looking for, especially when we're interviewing people, is me, for example. I'm looking at somebody who can have an interaction with me, a dynamic interaction, not a Q&A session. Nothing turns me off more on a candidate than it becoming a Q&A session where I answer a question and they answer and then it's silent. And I ask another question and I'm going down a list. No, I want active conversation with someone. And in that process, they can explain, their journey in life. Actually, if anybody at some point, I'll show you guys, how we map our journeys at McKesson. And the journeys are not like this. They're not just, on an upward trajectory, straight. They have peaks and valleys. People have jobs, people don't have jobs, people lose family members, right? Stuff happens. So they go like this, right? And that's important. Be realistic. Share that with the person you're interviewing with. They'll appreciate it.
I will agree with Mudassir that, we don't, most people nowadays, it's not that old school rule of if you have a break in your resume, or even if you're applying for a job now and you don't have one, right? It's not really about the gap on there. What really is much more important is how you choose to articulate that gap or the unemployment that you're currently in. And because how you choose to articulate it actually gives the hiring manager or HR an insight into your mental status, right? Are you negative about it? Are you, kind of bitter about it? Are you stuck in how to do things from your old job and you really don't know how to pivot and do next? And so you're just applying this job because you just need something, right? So what people are looking for when I look at resumes and I see that gap on there, that's not a big deal to me at all. My question always is, when I have candidates who are currently not working, my question is, and how have you been spending your time? Right? Mm-hmm. Because if they tell me, well, you know what, since I lost my job, I recognize that I was only at basic skill set for Excel. So I've been going to my library every week for the free classes that they have on Excel. And I've been getting pretty good at this, and this, right? Because what we're trying to assess is your ability to learn new skills, to pivot, and to actually get into something else. I also advise people when I'm doing resume workshops that if you have one of those gaps, to fill it in with additional things, whether it's a free class that you take at your library, whether it's volunteer activity. We look at things like ISGH and other Islamic organizations who are always looking for volunteers, and particularly in leadership roles. Right. So if you already have some of those skills and you have time on your hands, that's actually a great opportunity for you to kind of fill in and say, I worked as a project manager for this, nonprofit organization that was helping to mobilize the underserved community for X, Y, and Z in healthcare. right? You can be coming from any industry and you can volunteer for that. And that's a great way to segue into the healthcare industry if you're currently unemployed.
Yeah, no, that's spot on. I think we've got question and answers coming. If while we get the questions curated up, maybe I can ask each of you, what would be, of all the items you've heard, of all the pieces of advice that you've heard, or all the experiences that you've had, if there was one piece of advice that you would give to the audience, what would that one piece of advice be?
I'll start. I think, be patient, be willing to learn and adapt to what's around you, and Allah will open up opportunities for you as you go through that journey.
I'll echo that. And I think Azra said this very poignantly, I think praying 5 times a day sets a schedule and discipline in your life that can really help set you up for success in any discipline that you pursue.
And for me, it's Zahab's advice about seeking out mentors. Super important. I know that I had several mentors in my life and they made a huge difference.
I think Yasmin's and Azra's comments about saying yes early on, whether it's Azra, saying yes to a job she didn't know, or Yasmin, saying yes in, I forgot the context, but I know as an undergrad, opportunities open up when you say yes to things that you would have normally said no to.
And I guess for me, it would be, as the hadith goes, to tie your camel, right? So you have a plan, you have an idea of what you want to do, seek out those mentors, do the studying that you need to do, look at the opportunities that you need, but the rest is up to Allah. So sometimes one door may close and another one may open. So being driven and focused, but at the same time fluid, and allow kind of fate to drive you into the right place for you.
I think one thing I'll add is whatever you do, and doesn't matter how simple or complex it is, do it well. And I think that even goes if you find yourself not doing it too well initially, just work on it to improve. And I think that shows sort of, I think some of the corporate folks mentioned this already, but that shows, I think, a lot more potential really across the board than just being actually good at the one thing and sticking to your one thing to do it.
Yeah, spot on. We'll take the first question. I'm looking at increased innovation within the healthcare side, whether it's treatment or diagnostic. Does that mean the overall funding for innovation within healthcare has also increased?
I can take that a little bit. Acutely, yes. Whether it's going to be long-lived, I hope so. But I'm also, I think at least on the research side, research funding for things is notoriously finicky, and it's somewhat subject to politics. And so you definitely are sort of seeing a lot of sort of like seed investments and just kind of grants that sort of want to give money right away to start solving things, and that's great. But I think sort of the extent to which we see it down the line, I'm not sure. I do think that sort of infectious disease vaccine work might see a little bit of a bump, and sort of longer term investments for companies to sort of actually dedicate resources to having those production lines set up. I mean, to a certain extent, I do see it also having an impact on things like working on telehealth, right? And so people will probably more directly see the benefit of investing in those areas. So will it increase funding in healthcare overall? No, I think it might rebalance where that funding goes, though, within sort of specific sectors.
I'm going to see a lot of investment, I think, on the Medicare Advantage side of this, where, seniors, as they start to age in home, you're going to start to see, for example, what HEAL is doing, where they're delivering patient care at home. I think you're going to see huge investment from, VC firms into the home health space for sure over the next several quarters and years.
Yeah. Yasmin and Zahab, do you see that in the dental side as far as increased investments? I know you've had to make changes on how you deal with patients. Do you see funding coming in because of those changes?
For us, funding meaning like from the payer, from the insurance side, some insurances have been giving like a flat PPE reimbursement. It's not much. We still have to put in a lot more to keep things safe, but.
I think one of the major changes in healthcare that physicians that I've noted is that we are being reimbursed for virtual visits, which in the past was not true. So that I think that's one step in that direction.
Yeah, and go ahead.
I was just going to say, we have gone from pre-COVID, we had maybe a few hundred virtual visits a year to now 40,000 a month.
Wow.
I mean, it's a huge jump. And I think some of the easing of the regulations has played a big role in that. Yeah.
Yeah, and you know, speaking of regulations, Imad, I don't know, maybe you can comment on the new regulations that are coming in from the CMS on the entire virtualization of you know, primary care and going after, you know, rural setting care, with Medicare being able to provide care for individuals that are out, you know, in rural settings.
Yeah, I'll take this by two phases. One is I think we need to see more economic relief from Congress on, you know, supporting medical practices across the country that are vulnerable right now with COVID. So we're starting to see increased legislation on economic relief, right? That would be one. I think to your second point, clearly CMS is looking at how to better and effectively reimburse for telehealth visits, for remote monitoring. I think the verdict is still out on this. It will continue to evolve, but I'm fairly optimistic that CMS will start to open up not only the reimbursement for telehealth, but also then how does a physician start to practice across state lines? So kind of lessening the burden, so to speak, on that whole notion that I was talking about earlier around the digital centers of excellence, like in order to allow for that administrative ease. I think I see that also in the horizon from a regulation perspective. I think the biggest piece the industry is going to have to deal with is on privacy of data when you start to open it up to this level. I think that's going to be the big issue from a regulatory perspective. Just given concerns that people have of their patient health data, that's going to continue to be an evolving discussion in the marketplace.
Yeah. Another question that's coming up is, with a busy schedule, how do you assess opportunities, and generally, how do you assess opportunities? What, you know, the Venn diagram, good, bad, and somewhere in the middle, or how do you assess your opportunities when you do see them? Let me pick on the surgeon here. You've got a busy schedule already. You're taking care of patients, you're saving lives, and you're in OR. When you see something that's coming up over the horizon, what are your you know, to-do list or factors that you assess?
Great question. You know, I think especially throughout my training, I always had this same philosophy that many people have brought up, is like, never say no. You know, always have a yes, but then you have to find a way to fit it into the busy schedule. And I think a lot of that is, yes, you know, there's only 24 hours in a day, but more often than not, if there's something that we're really passionate about or something that we're committed to, we can find time for it, whether it's on the weekend, after hours. And now there's so many virtual ways to be involved. I think it really just starts with having that priority, having that passion, and having that availability in your mind that, you know what, I can make time for it. And that usually falls into place.
I would say look at, you know, when you have like 12 things you could do, which ones do you think will give you the knowledge, experience, or, you know, some additional insight into where it is that you want to go? You know, like everyone, I think at some point you have that vision in your mind, you know, what does that gold star look like at the end of your career? You know, what is it really going to look like? And so if you've got 12 things that you could say yes to, and you really can't find a way to fit all 12 of them in, you know, pick and choose the ones that you think are most likely to weigh into that end goal that you know that you have in your mind. And if you can't filter out or prioritize those opportunities even from that lens, then, you know, also think about it from the lens of, one of the questions I always ask is, okay, if you're 90 years old, 100 years old, and you're on your deathbed and you were to look back on your life, what's the regret that you're going to have that you said, no to and what you said yes to, right? Are you gonna say, yeah, I was glad I took that opportunity because it led me to this, this, and this, or are you going to regret maybe, and I'm just gonna say, not spending enough time with your family, or regret this, right? Like you have to balance it as well. And when people prioritize, because I think some individuals will find that they will have more opportunities than they can pursue, and that's okay. You just have to be okay with your answer, right? Like you have to be okay with your answer, that you're not looking back and saying, oh, I should have done this or something, right? Like just, have that level to say, I said yes to these 5 things because 12 couldn't fit, and 100 years from now, I'm going to be just fine with that decision. So,
kind of building up what Azra said, I think before an opportunity arises, you should always be checking in with yourself and figuring out like what really drives you, what are you really passionate about, and when an opportunity comes, use your passions and what drives you as kind of like a benchmark. Like, does this opportunity, meet the benchmark of helping me achieve that goal that Azra is mentioning? And I think also the other thing I would mention is, if something scares you, ask why does it scare you? If an opportunity scares you, is it scaring you because there's genuinely something, that you don't know? And, a fear of the unknown is oftentimes a great opportunity to grow and learn. And so if there's something that's scary to you, maybe that's where you should be going. Maybe that's Allah, or your intuition, or mostly Allah, just telling you, hey, this is the way you should go. And because it's scaring you, it means that there's something to learn here.
So there's this concept. There's this concept of fail fast in the technology domain, right? Where you try something, you fail at it. If it's fine, move on to something else quickly, right? But don't digress. Don't just just try things, experiment. And another thing is, right? To be brutally honest, there's this narrow window between when you are junior in high school, and then college, and when you have kids, where you can do crazy stuff. I had 2 startups at that time. You can work 20-hour days. You can go days without showering if you want, but you can try stuff. You can work really hard. You can make something. It becomes really hard once you have kids, right? Because you have to spend time with your family and your kids, especially your kids, right? So use that narrow window to make something. Go after your dreams. Challenge yourself.
Yeah, no, spot on. Maybe I can take the last moment to just do some administrative items. We've got 10 winners that came in. We had some raffle for a couple gift cards, and the panel has agreed to do some mentoring sessions. Know that Yasmin and Khalil are in UAE, so be aware of their time. I really appreciate you guys hanging in there with us. What is it, like 2 a.m. there right now? So appreciate that. Let me announce these winners. We've got Sarfaraz Amin, Reeb Khan, Sarah Khan, Hamidullah Rahman. It looks like a couple of you have just the first name: Javed, Razak, Musa, Abdul, Nashwa Khalil, and Tyler. All the names, and then you've got Tyler at the end. So thanks, Tyler, for joining in. And with that, I'll mention that we've got an oil and gas panel that's going to be coming in next week, and I want to leave with one comment. If you wanted to invite someone to be inspirational or innovate within healthcare, or inspire a young or a person that's looking to pivot, what is it that you would give as an inspirational thought to innovate within the healthcare side? Maybe we can start the other way. Start with us and work ourselves backwards.
I'm sorry, what was the question again?
If you were looking to give advice to someone who is getting inspired to get into healthcare or innovate within the healthcare system, what would that be?
That advice would be always be learning and curious. Just be curious. I mean, even if you may not get to wherever it is that you think you were going to go or where you wanted to go right away, but every conversation, every article that you read, everything that you do, actually is teaching you something. And so be curious and always tend to nurture and foster that continuous learning passion within you.
Excellent.
So one of the things that we say at MIT Pathway Medicine during the events, when a participant doesn't know what they can bring to the table if they're not a doctor or not a biomedical engineer, we remind them at the very least they are a patient, right? So healthcare is something that affects all of us. Even if we haven't gone through the healthcare system, someone we love has gone through the healthcare system. So we're all patients, and knowing that and having that perspective, there's always something that we can contribute in ways to make it better, or some ideas to make it better.
I think my two little tidbits are, one, sort of the more lofty, inspirational. Don't shy away from any idea just because you think it's a bit wild. I think, chances are someone else has had that idea, no matter how wild it was, and they also shied away from it. So don't do that. But at the second time, and sort of to ground everyone, I think if you want to implement, ground yourselves in sort of what the reality of the situation is on the ground. And you can do that by just talking to people, getting people's perspectives. Some people might be negative, and that's okay. But, I think healthcare is a field littered with literally all the inventions over the years having come in spite of people not wanting it. I mean, even the famous case of the thermometer is my favorite story, where when it was first invented, a lot of doctors were insulted and said that, it's my job to put my hand on this forehead and tell you if you had a fever or not. Why will I use this machine to do it? And I think it's a lot of, it's just a sort of reshaping, and it takes a while for innovations to actually get into healthcare. So don't be demoralized, but also be pragmatic.
I think, to add on to that, this came up earlier on, but I think whatever you choose to do it to the best of your ability, pursue excellence. I think that, especially in the ecosystem of healthcare, is about to say that is the end product of what we do really reaches people very directly within themselves or their family members, and it's an avenue where we should really pursue excellence.
Yeah, I would add, healthcare today is in dire need of innovation, right? We need to elevate, I would say, care away from being reactive, scaled, and say one size fits all. That's what the current model offers. So if you're trying to pursue innovation within healthcare, I think, start to think about the opportunities of how you manage the holistic experience of healthcare for a consumer and the patient within the market. And you can definitely add a lot of value in that type of mindset.
Is it me? Why don't we go to Mudassar and I'll take the last thought.
Sure, sorry. So I would just going to echo what Yasmin said. The healthcare space is not just for doctors or surgeons. We need IT engineers, data scientists, revenue cycle people, biz dev people, finance, accounting, you name it. So don't be afraid. We need diversity of thoughts and opinions and experiences in this space. Look around.
All right, I guess that's me. I guess my comments are kind of building on what Khalil said, dream big, but dream grounded, right? Like big dreams grounded in reality are what win, the Nobel Prize, for example. I'm sure that, a lot of these crazy ideas came from places that were grounded in reality and grounded in helping people. There's a famous saying, he or she who dares wins, right? So if you're willing to do the crazy thing and kind of put your neck out there, you may be able to change the game. With that, I mean, not to endorse any political party, one way or the other, but there is an election coming up. So just want to put it out there that, everyone should vote if they are a U.S. citizen. Just not to endorse any one political party or another, but just vote, please. People should
appreciate the
visit.
reminder. Yeah, appreciate the reminder. Did you have something else, Maz? Excellent. And, the other reminder is next month, oil and gas panel that we have. I'm impressed, humbled with the panel that we have. If you have any questions, feel free to email us. We'll get it to the right moderator or panelist. Stay positive in what you're doing. No matter what plans you made, Allah will make a plan for you. And I pray for everyone who's been impacted by COVID, whether they're the ones who are getting sick or their loved ones or their jobs. And I really appreciate you all joining in. And please reach out to us if you need any help, and go out and vote. Thank you very much for joining.
Thanks for moderating, Bakar.
Thank you.
Great.